Hello, in this video we will discuss about the important topic or important lesson about the physiology of the cardiac output. So the cardiac output is related to the blood pressure. We will also understand about the blood pressure and the nervous system innervation with the heart. And on the other hand, the cardiac output, also known as heart output, and denoted by symbols Q, bigger Q or QC, and this is basically the cardiac output, and describe the volume of blood being pumped by both ventricles of the heart. So that is the per unit time. So the per unit time we can say that is within the range of per minute. So the per minute we can denote by this, and the per minute we can measure that. So that again I am describing about the volume of blood being pumped by both ventricle of the heart per unit time. So the cardiac output is equal to CO is equal to QC is equal to heart rate product. So what is heart rate? Here is the beat per minute is equal to BPM, and stroke volume is equal to SV. What is stroke volume? Stroke volume is the volume of blood pumped from left ventricle per beat. So the per beat, the per ejection of the blood is known as the stroke volume. So the bigger heart will produce the more stroke volume. So important you should need to understand. So let's begin to understand the recap the heart structure. So here is the right atrium, tricuspid valve, and right ventricle between both atrium and ventricle tricuspid valve, and here is the inferior vena cava and descending aorta, and here is the apex, and this is the left ventricle and left atrium. Between the left ventricle and left atrium, that wall is known as the mitral wall. Anyhow, this is the pulmonary artery contain deoxygenated blood, and pulmonary vein which that's contain oxygenated blood. An arrow shows that the superior and inferior vena cava which that is drain the blood into the right atrium, while the pulmonary vein which that drain the blood oxygenated to the left atrium. So remember about that. This is stroke volume due to the ejection of the blood, and the bigger size of the heart will produce the more stroke volume. So remember and keep understanding. So here is the person. For example, I am checking the heartbeat of the normal person. So this normal person contain a normal blood pressure. Normal blood pressure during the systole and diastole. Let's begin to understand the systolic pressure. Systolic pressure means the blood pressure due to the heart contraction. So the contraction of heart will lead to 120 millimeter of mercury blood pressure due to the strong contraction, and the aortic arch which that create a more blood pressure, and further going on to the artery and arterioles that will be decrease the blood pressure. So remember about that. On the other hand, the diastolic blood pressure is the 80 millimeter of mercury because the dilation of the heart. During the dilation of the heart, that is why the aortic arch contain less pressure. So that is why. So here the factor affecting heart rate we will discuss HR. And factor affecting heart rate basically is the possible due to the heart rate will change throughout the day. So that is why it's factor which that affect the heart rate. And what is the factors? We will discuss about autonomic innervation. For example, sympathetic nervous system will increase the heart rate, and the parasympathetic nervous system will decrease the heart rate. So that is why the autonomic nervous system which that innervate, and hormones, for example cortisol will increase, and norepinephrine and epinephrine will increase, and fitness as well as age due to the stiffness of the artery. So here is the systolic and diastolic blood pressure equal to HR, heart rate, and this is basically we can calculate by this collection is the 200 heart rate, and this 200 is the heart rate which that is we can negative with the age. For example, 20-year-old person which that's contain negative to 180 beat per minute heart rate. So it can be basically diastole and systole both beat. So here is the factors affecting stroke volume we will discuss. Previous was we are discussing about the factor affecting heart rate, but here is the factor affecting stroke volume. So the factor affecting stroke volume mean the volume, stroke volume are present in the left atrium which that pump out that blood, and how much blood will pump out, that is the stroke volume, and it is variable. For example, the healthy person contain more while the less healthy person contain less due to the less volume as well as the stiffness of the artery, and that is why the blood pressure will more of the aged person. And here is the heart size more, so the stroke volume will more. And fitness level depends on exercise. So here is the duration of contraction as well as the here is the preload, and diastolic volume is the heart should be complete empty, so the end diastolic volume will be more. So the after will be basically is the preload, and in this way blood should be less but the volume will be more. And after load is the resistance. After load complete ejection is so important. So the here is the equation, you can see the stroke volume is equal to stroke SV, stroke volume is the end diastolic volume minus end systolic volume is equal to 120 ml per and 50 ml respectively. We can negative to each other. In this way the 70 ml is the stroke volume which that is come from here. And here's the end diastolic volume mean the field volume of the ventricle prior to contraction, so the contraction required. So the end diastolic volume will be complete and the 120 ml of blood, while here is the end systolic volume is residual volume of blood remaining in the ventricle after ejection of end systolic volume about 50 ml of blood. So the 50 ml of blood and systolic volume due to the decrease and constrict the constrict the heart wall, and when constrict the heart wall it means the complete ejection and the remaining blood is the 50 ml, while the field and diastolic volume will be 120 ml, but the volume of the space will be more. So let's begin to understand the cardiac output. So this is the cardiac output. For example, this is the normal person which contains 70 kg normal weight, healthy individual, and cardiac output is at rest is basically average about 5 liter per minute. So how to calculate we will discuss also, and about 5 liter per minute, and assuming that the heart rate is equal to 70 beat per minute or 72 beat per minute. And the here is the stroke volume is can be 70 ml because we had calculate. So in this way here is the you can understand in this way. So the cardiac output is equal to heart rate and stroke volume. We can multiply. So here we can understand the stroke volume, and we can calculate the stroke volume by here. You can see, and this basic equation show that here is equal to 0.071 liter per beat. So the one beat will contain 0.071 liter blood ejection or stroke volume. So the cardiac output is equal to per beat is 0.071, while here is the formula is the cardiac output is equal to heart rate and the stroke volume which that is liter per minute, and we can say that is here is a cardiac output is equal to 0.071 per liter per beat. So here we can draw the per minute, and in this way we can say that is 72 beats per minute. So we can calculate that 5.11 5.112 liter per beat per minute. So the cardiac output can be variable from 5 to 6 liter per minute output. So the output is basically is the cardiac output is the stroke volume, and that is the stroke volume, which that is we can calculate also. And the stroke volume is equal to 0.071 liter per beat, and in this way we can calculate that just simply. And during exercise is 23 liter per minute increase more. So here is the person. You can stop that my video to watch the calculation. So here is the person which that's contain brain and heart and blood circulatory system, which that is going to complicate it, going to complication of the some reason. But we are just understanding about first of all what is the mechanism with brain controlled by heartbeat. So this is the brain which that's contain dark black color is the cardio-regulatory center. This is the cardio-regulatory center are present in the medulla. So the medulla, upper medulla. So what that means? That means here you can see this is the medulla. Upper medulla is the pons, while here is the medulla oblongata, which that's contain chemoreceptor. So remember about that. This is the chemoreceptor. Receive the chemical, for example, carbon dioxide and oxygen. So here is the heart, which that's contain different region. Here is the baroreceptor are present here, which that use and check the stretching of the wall of the aortic arch. And here is the carotid body chemoreceptor used for the chemical, and this is the baroreceptor in aorta as well. It is also used for the stretching and the balancing of the heartbeat. So that is why it is the baroreceptor. And here is the sensory nerve will transmit from heart to the cardio-regulatory center. After the processing into the cardio-regulatory center, it will not transmit directly into the brain because the work is less. So the less energy required for the beating of heart. So that is why the here is the control is the basically is the sensory nerve, which that is basically detect and beat of heart. And here is the red color shows that the parasympathetic nerve fiber, which that is also arise from the uh, medulla oblongata chemoreceptor. And after this here you can see this the baroreceptor in aorta, and this is the cyanoatrial node. The cyanoatrial node is basically is attached with the sympathetic nervous system, which that is used and regulate the nerve, regulate the heartbeat. For example, sympathetic nervous system will increase the heartbeat and also target to the adrenal gland after the sympathetic nervous system prolong. And in this way, the adrenal medulla will produce the hormone from the medullary part of the adrenal gland into the blood circulatory system. So that is known as endocrine system. So this is the endocrine production of epinephrine and norepinephrine. This epinephrine and norepinephrine will lead to increase the cardiac output. It means the heart rate and stroke volume will be increased. So the stroke volume also increase and heart rate will also increase per minute also, or per beat also. So remember about that. That things is a control mechanism of sympathetic nervous system and parasympathetic nervous system. So the baroreceptor is used for the balancing of the heartbeat, while the chemoreceptor is used for the detection of the oxygen and carbon dioxide and beat more heart due to the absorption of oxygen. On the other hand, here is the complication in the, for example, the atherosclerosis or arteriosclerosis due to the tightening of an artery or vein. And here is the partial blockage due to the atherosclerosis due to the different complication, for example diabetes or some hypercholesteremia. And high blood pressure will increase the blood pressure due to the blockage, and that's high blood pressure will lead to heart rate increase, brain clotting, hemorrhage, brain hemorrhage, and bleeding also, and the bursting of the artery. So remember about that. A clot in the neck may travel to travel to and block artery, so that is known as the stroke, her brain stroke. Due to the stroke means the breaking of the artery, and that is basically important things you should need to understand. The carotid artery, which that is uh, uh, will lead to increase the blood pressure, that lead to brain hemorrhage. So here is the blocked blood flow to increase the heart rate, and heart attack can be, and memory loss, dementia, and loss of sight due to the thin arterioles which that are present in the brain and eyes. So thanks for watching.